Hi guys, Adam from Kinetics Physiotherapy here again with another video. This time we're going to be looking at acupuncture for tennis elbow, so right into the forearm here. For those of you that don't know what tennis elbow is or want some more information about tennis elbow, I'll leave a link to one of my previous videos in the description, which I covered all about tennis elbow and also some self-sports massage that you can do to try and ease the symptoms and ease the pain in the arm if you can't do acupuncture or you can't access somebody that can do acupuncture at the moment. So in this video we'll look at techniques or where you can put the needles. That'll be helpful, so for clinicians that do acupuncture, a bit of a refresher, and also for those sort of people that want to consider acupuncture to ease their symptoms and don't really know what to expect. This will be a nice introduction to it, so you've got some idea of what's going to happen going into it. So when we're looking at acupuncture for tennis elbow, so the main site of pain that you'll find will be on this bony bit on the outside of the elbow here. That's usually the tender bit where you get most of the pain with tennis elbow. But when it comes to acupuncture, we're going to almost ignore this bit, similar to massage, because it will be quite sore, and we're going to come down into the muscle belly around here. So we're looking at this meaty bit around here, this spongy bit, and to make sure you're in the right place. So the muscles that are affected with tennis elbow, they extend the wrist and lift it up, and they also extend the fingers, so they lift the fingers up. So to make sure you're in the right place before you go sticking needles anywhere, you can wiggle your fingers. You can just about see them moving on me. You see those muscles contracting there, and you can also bring the wrist up and down so you can see a bit clearer more around this area here. Now this is going to be the main site for where you put the needles in, and when it comes to clinicians refreshing themselves, there's not really any structures you need to be worried about around here, as long as you don't go towards the inside of the arm here, and you mainly focus on getting the patient or the client palm down and working on this sort of meaty bit around here. You generally you're pretty safe going along here. So the needles, if anyone's interested in using sort of classic plus needles, they're 25mm length. You can use thicker ones or not thicker, longer ones if you have someone that's a bit bigger, but I'm a little bit scrawny, so don't necessarily need such big needles. And if you open up the needles here, so the needles come in packets, usually of 5, in a big box, and they're all sterile, so they're completely clean, and then they come out individually. You can open them up here, and then just for those people that haven't seen them before, they come in sort of a little tube here. So this needle in here is completely sterile. It doesn't reach the end, so that's completely, this is just a plastic tube, and it's got a little pin in the top. And essentially what you do is you pull the pin out the top, he says, like that, and secure the needle. So the needle is in there. I'm holding it in there by putting a bit of pressure on the top here. And then what you do is you then line it up with wherever you want it. So generally you can go in any of this sort of area around here. So you can start in the top of this meaty bit here, let go of the needle at the top, and the needle point will rest against your skin, and then you just give it a swift tap, and it goes in the skin there. So you can just about see it around there. I can move a little bit closer here, so there you go, that's a better view of it there. So then once the needle's in the arm there, what you can do is you can adjust it. Generally speaking, you'll go in at about 45-degree angle, and then what you do is you just feed it into there and leave it, and that's all there. So then you've got a guidance tube and a pin. Those can just go in the normal rubbish. Okay, and then what you would do is then get the next tube here, again pop the top off, get rid of the pin, line it up. Generally I like to go in a straight line down the arm here. You can deviate a little bit, so say there was one particularly tender bit around here or a difficult bit around here, you could focus a few more needles around here. I don't have any tennis elbow type pain, so I'm just going to show going down the arm here, but you can go as far as sort of there's a bony bit that you'll feel around here. You can pretty much use that as a border, so you can go up to that point here, so you can even go as far as around here and come across, and then coming on across here. You don't want to go too far towards, again, the underside of the arm, because then there's a few blood vessels that you want to try and avoid. So generally speaking, this bony bit around the outside of the arm here, around this bit here, is your main line, and coming in a little bit. So I like to just go along here, again, just line it up, let go of the needle at the top so it rests against the skin, give it a tap, and it's in the skin there. and then you just adjust it to around 45 degrees here, feed it in about halfway, and then leave it. Okay, and then I'll go through the rest of the needles here. So again, coming down that little bit further, there's less meat around here, around these sort of areas, so you don't necessarily go all the way down to the wrist, because again, there's less muscle there, so it's not really as relevant. The main muscle bulk sits around here, so I'll generally do maybe 2 or 3 along here. Again, give that a tap, adjust it, and go a little bit more towards a bit of a less of an angle, because there's less meat around here, especially on me being a bit scrawny. And the last one here that I'll do, again, I'm not going to go any further down towards the wrist, but I'll go back up to this meaty bit here, because this generally will have a few tender bits in it. And then what you'll do is go somewhere in the middle here. Again, rest it against the skin, give it a tap, adjust it, and then just feed it in there. Okay. So we've got 4 needles there. You can put more in. Generally speaking, I'll put maybe up to 5 or 6. It's not essential. It's more just depending on the person. So I'm do acupuncture on a daily basis, so it doesn't really bother me too much. But if you have someone that's not a huge fan of needles, you might want to just leave it at a few there. Or if you have someone that's got a really tender or really sore tennis elbow, they might not tolerate as many. But you don't have to turn them into a porcupine. You don't have to have hundreds of needles in their arm. It's just not necessary, especially with dry needling and medical acupuncture. You generally need a few in the muscle that's giving you trouble. I'd probably put another one in maybe around here. In fact, I'll do that now because I've got 1 needle left. So take the top off here, going around this area here, give it a tap, breaks the skin, and then just feed it in there. So one of the main things that people get concerned about with acupuncture that have never had it before is, does it hurt? And generally speaking, no. As you can see, I didn't even flinch, and I'm not an enormous, I'm not a huge fan of needles. So generally you'll feel, when you get the tube and you put it against the skin, when they tap on the end there, you'll feel a bit of a scratch as the needle breaks the skin. But that really is it. It's like you scratching the skin there. It might feel a little bit sharp, but that's all. And then when they're feeding the needle in, it feels a little bit odd. Sometimes you can get a twitch in the muscles there. It didn't happen with any of mine. It might happen in a minute when I adjust them. It's completely normal. You can get a bit of what's called a twitch response where the muscle contracts. And it's just when you put the needle into an area where it's a bit tighter, a bit tender. But with acupuncture, once the needles are in, you don't feel them. You don't. There's no pain ongoing at the moment. You can tell there's something in your arm, but besides that, there's no pain at all. And generally, what you will do is leave them for about 10 minutes, and then what you'll do is you'll come back along, and they'll be quite settled. You won't really notice they're in there. And then what you'll do is you'll go 1 needle at a time, and you'll either twist them and twizzle them around, which you can do there, or I like to pulse them in and out a little bit, and maybe put them in a little bit further if they're only halfway in or so. You don't put them all the way up to the hilt. There's always a little bit of room there. Just in that, it's never happened to me, but on the very, in theory, if you had a faulty needle, it could break, and it just gives you nothing to hold on to pull out. And if it was going to break, it'd be at the hilt there. So you just never put it all the way in. It's not necessary a lot of the time as well. But then what you would do is, 10 minutes in, go along, give the needle a little bit of a pulse stimulation here, or you can give it a little bit of a twizzle as well if you want to. Pulse them in and out a little bit here. Lovely. Again, sometimes that'll get that twitch response, but not always. But it can be really useful to settle down really severe pain. So particularly if it's really tender with massage. So thinking back, I had one particular client, he had incredibly painful tennis elbow, probably the worst I've seen. And it was so tender you could barely do any sort of massage even to this area here. So what we did is we got 4 or 5 needles, put them in a similar distribution to this, a similar area, and it helped settle down the pain enough so that he could do some really gentle exercises. And just for a few days, and then a few days later we did it again to settle it down, and it helps relieve the tension in the short term. But what it also does is it's got a sort of numbing effect to the nerve receptors around there, so you experience less pain, which means you can do exercises to try and tackle this in the long term, which in the future I can do in a video if you guys like. Let me know in the comments below, and I can make a follow along video for tennis elbow exercises to try and settle it down. So then what you would normally do, leave them for again another 10 minutes or so, and then give them another pulse stimulation there. So pulse them in and out, like so, and then leave them for another 5 minutes or so. You can also, with acupuncture, some people do electro-acupuncture. It's not something that I do. You can do it. You essentially attach some electrodes onto here, and they pulse electricity through there, so the muscle will contract and relax. It's supposed to be more effective. Again, it's not something that I do. I might do it in the future, but I've found this to be effective enough. I think the electro-acupuncture is a little bit more invasive and can be a little bit sore. So for the clinicians that are watching this, you then make sure you've got your sharp spin handy. Open that up, and then what you do, make sure it stays open. Take them out, and they go straight in there. So sometimes you can get a little bit of blood come out as well, just because there's a very small blood vessel that you've hit. Again, generally a little bit of a dab with a tissue, and it'll all go away. So I hope that sort of short video on acupuncture gave you a better idea of what to expect if someone suggests it for tennis elbow, or if you want to try and refresh your skills and do it on someone in the future. There's one thing that I didn't cover in the video, and that's the size of the needle. So a lot of people, again, they're worried about the pain with acupuncture because they're worried about the size of the needles, and that's usually because the only comparison point that they've had for having any needles put in them is an injection, or having blood taken. Now, with acupuncture, the needles are significantly smaller. So I've just unwrapped one here. If I just take this out of the guidance tube here, and I'll show you. So you can see here how fine the needles are here. If that's focusing on there, that'd be great. But they're very, very small. In fact, they're the size of a cat's whisker, I think. And essentially, they're much smaller, so then they won't hurt when they come in. And they can be a lot smaller because you don't need to pass any fluid through there. So if you're having an injection, it's a hollow tube, and you've got to pass the fluid through there into your body. Whether you're having a vaccination or if you're having blood taken, again, it's the other way around. You've got to draw fluid through that. So it's got to be much bigger. Those are much, much smaller. So you don't generally have that dead arm afterwards. It might feel a bit sore for 24 hours, particularly if you have a lot of them, and you can have longer needles as well. Those are the smallest ones that you've got, because the forearm, again with me, is particularly meaty, but you can have some slightly larger ones, but it's not always essential for the forearm. And you might feel a little bit tender for 24, 48 hours, but then it will go. It won't be to the point where you can't lift the arm if you have a vaccination, just because it's so much smaller. And it can be really, really effective. So it's worth giving it a try. If you don't like it, you can just whip the needles out, no harm done. And but if you do have any questions in the future about acupuncture for tennis elbow, or anything you'd like me to cover in the future, then let me know in the comments below. If not, leave a like and subscribe, and that sort of concludes the video on acupuncture. So I'll see you in the next video. Thanks, guys.